Hey, do you know if your Medicare Advantage plan truly covers all your healthcare needs? Networks are one of the most confusing aspects of Medicare Advantage plans, and misunderstanding them can lead to unexpected bills, delaying care, and lots of frustration. But here's the good news. In today's video, I'm going to break it all down for you. By the end, you'll know exactly how Medicare Advantage networks work and how to avoid costly mistakes and how to maximize your plan's benefits. Let's get started. So understanding Medicare Advantage networks. Medicare Advantage plans operate through networks which determine where you can go for care and how much you're going to pay. Let's break down the three main types of Medicare Advantage networks. You have HMO, health maintenance organizations, which in HMO, you're required to use in-network providers for all your non-emergency care. Referrals are often needed to see specialists. For example, if you needed outpatient surgery, your doctor may need to request prior authorization from your insurance carrier. Without that approval, the plan might deny the coverage. So this can sound restrictive, but HMOs usually offer lower premiums, making them an attractive option for cost-conscious seniors. Hey guys, one of the biggest things I want to make sure you understand about the HMO Medicare Advantage plans and there's really two primary things that are important. One, the costs for copays and services and access to services typically are going to be much less on HMO plans. And then secondly, the network footprint in metro areas, typically HMO networks are huge in metro areas, and usually somebody doesn't have to enroll into a PPO unless they're in a rural area. And here's the last part of this HMO structure and function of the HMO when it comes to referrals. And this is probably the most important thing you're going to hear all day on this video, other than the last thing I'll share at the very end. And years ago, when I first got into this 17 years ago, HMOs required primary care doctors to refer to specialists. And if you went to your specialist after you've been referred without another referral, they would push you back over to the primary care doctor. So it was like a revolving wheel, and people would get frustrated because on an HMO plan, they had to go to the primary or call the primary to get a referral to go to the specialist. That has been done away with. It's been gone for several years now. Once you go to your primary and you're structured in with another specialist or 3 or 4 specialists and they're all in network, it's not required for you to get a referral to go to that specialist. Call the specialist, schedule your appointments, go see the doctor. That doctor will communicate back to the primary care doctor. The primary care doctor will communicate to the specialist. There's no referrals required in almost normal circumstances of seeing a primary and a specialist. Now, surgeries and coordinating care like that, a lot of times there's authorizations required, and if a referral is needed, the doctor will typically communicate that and they do that for you. Typically, you're not going to be responsible for having to do that. So PPOs, preferred provider organizations. PPO plans give you the flexibility to see out-of-network providers, but it comes at a higher cost. For instance, you may pay 40% for the cost for out-of-network services versus 20% for in-network care. Some procedures like major services or surgery still require prior authorization even with a PPO. However, the added freedom makes this popular choice for those who want more control really over their health care. Now, point of service plans, POS plans combine features from both HMO and PPO. While you have the flexibility to go out of network, you often need referrals for certain services. This hybrid option can work well for those who want a balance between cost savings and then flexibility. And with this, always confirm with your provider's network status before scheduling care. Even small errors in understanding your plan's rules can lead to big bills. And when it comes to networks, just make sure you ask your primary care doctor what specialist you can go to, and you're typically not going to ever have any problems with the network. You can always call the specialist and just confirm, are you still taking this Medicare Advantage plan? So you would tell them the Medicare Advantage plan. Typically with your Medicare Advantage plan, the card is going to have an H and a big long number. Usually the last 3 numbers is the numbers we look for identification on what plan it is, like 054, 001, or 002. So you need to make sure this is the HMO Medicare Advantage plan I have. Do you guys take this? Well, this is the PPO Medicare Advantage plan. Are you in network with this? So asking if they're in network with PPO is very important. If not, and they bill out of network, you're going to pay higher cost. And don't forget, with PPO plans, when you go to out of network, the doctor is not required to process bill. It's not mandatory by Medicare or the health plan just because you have a PPO plan that you can just go to any doctor. The doctor still has to accept the terms and conditions of the plan. and take the billing, which is typically standardized billing, pay to the doctor through that plan. And if they don't want to do that, they don't have to, and a PPO plan is just as useless as a piece of paper. So, common network problems and pitfalls. Now let's talk about some of the most common challenges seniors face with Medicare Advantage plans dealing with out-of-network charges. If you see a provider who isn't in network, you'll likely face much higher costs. For example, one senior we helped, Tom, scheduled an appointment with a specialist assuming they were in network. He later received a $500 bill because the specialist had left the network. So simple steps like verifying network status beforehand can save you from this type of surprise. And then prior authorizations. Many Medicare Advantage plans require pre-approval for certain services like MRIs or surgeries. This can delay care if not handled correctly. So for instance, if your doctor forgets to submit the required paperwork, the plan might deny coverage, leaving you with a full bill, or you have to appeal that. Limited access in rural areas. This is a big one, folks. So in rural regions, finding in-network providers can be challenging. Some plans have fewer contracted doctors and facilities in these areas, which can force seniors to travel long distances for care. The solution really is always use your plan's online directory or call the customer service number to confirm coverage before receiving care. Especially, guys, if you're going to see a new doctor, just clarify if they're taking the plan still. It'll save you a lot of stress, time, energy, and money. So Sarah, a Medicare Advantage member, needed a knee replacement. Her doctor submitted the prior authorization paperwork, but it wasn't complete. By following up with her insurance carrier, Sarah ensured the documentation was corrected and the surgery proceeded without delay. Planning ahead and understanding the plan's rules can save you time, money, and a lot of frustration. Guys, plan ahead, ask questions, always be informed. Now let's step into the real-world success stories of Medicare Advantage. Success stories show how understanding your network can make all the difference. For example, John used his plan's provider directory to find an in-network cardiologist after being referred by his primary care doctor. By confirming coverage ahead of time, John avoided a $2,000 out-of-pocket network bill and received the care he needed stress-free. With Medicare Hub, we help seniors navigate their plans to avoid surprises like this by looking up your doctors, your specialists, hospitals, medications, and everything that you need to ensure that you're going on the right Medicare Advantage plan, and then explaining how to use the plan correctly, giving you a systematic way to understand how the plan works, and then how to be able to ensure that you're going to the right doctors and things like that. It's not complicated unless you make it complicated. Understanding Medicare Advantage plans, the different health plan options, and how networks work. It's a simplified process if you have somebody explain it to you correctly, and that's what we're here to do. Hey guys, I want to take a moment and say thank you for watching. Don't forget to like, to share, and subscribe to our channel. Watch more of our videos for expert guidance on Medicare. Let's make navigating your health coverage easier together. And if you're new to Medicare or you're still just totally confused, register for one of our free Medicare Made Simple on-demand workshops or live workshops by clicking in the link in the description below.
Thank you.